so much for coming. I appreciate it, and this, I think, will be I hope it will be a useful and informative session. First off, I'd like to introduce the panelists who are here. In addition to myself, I am the Managing Director of the Malaria Policy Center for Malaria No More. I'm a former member of the Foreign Affairs Committee and a former ambassador to Tanzania. To my immediate right is Carrie Stover, who leads the Global Network for Neglected Tropical Diseases. Then we have Dr. Christopher King from the Center for Global Health and Diseases at Case Western Reserve University. And then finally, Ambassador Mark Dybel, formerly the head of the U.S. Global AIDS Coordinator's Office, and now with the UN Special Envoy's Office on Malaria. Very briefly, a number of people have asked why it is that a group like Malaria No More would be supportive of the expansion of the Congressional Malaria Caucus into the Congressional Malaria Caucus and Caucus on Neglected Tropical Diseases. I think, quite frankly, there are several very important reasons. First off, most importantly, because of the suffering that both malaria and neglected tropical diseases cause throughout much of the world. Together, malaria and the 7 most common neglected tropical diseases cause nearly 2 million deaths each and every year. An African child dies every 30 seconds of malaria. This terrible disease costs more than $12 billion each year in lost productivity and costs many African nations more than 40% of their health care budget. It wreaks havoc, quite frankly, on villages and governments throughout the continent. On the neglected tropical disease front, an estimated 1.4 billion people, that's 1/6 of the world's population, are infected with one or more neglected tropical diseases. In short, malaria and NTDs cause limitless human suffering and devastate developing societies at the very time they're struggling to rise and to get ahead. The second reason is because most, if not all, of the countries that are gripped by malaria are also gripped by neglected tropical diseases. The geographic overlap of malaria and neglected tropical disease facilitates the sharing of healthcare expertise, treatments, and distribution mechanisms. I think sometimes when policymakers back here talk about neglected tropical diseases versus malaria versus HIV, I don't think they quite understand that when someone is afflicted in Africa, they don't look around to find the malaria clinic. They go to the nearest healthcare facility that they can to get treatment. Combining neglected tropical disease treatment with the current malaria control efforts significantly reduces anemia-caused morbidity and mortality for less than 10% additional cost. It's cost effective. That's one reason why in so much of the world, malaria actually is a neglected tropical disease. When we talk about the expansion of the Caucus, while that may be news here, it isn't news in so much of the world. In much of the world, for example, in the United Kingdom, their all-parties committee had long been expanded to cover both neglected tropical diseases and malaria, because quite frankly, that's how malaria was viewed and has been approached. But I think the most important reason and the strongest argument for the expansion of the Caucus and really talking about neglected tropical diseases and malaria together is because, quite frankly, our approach is postured similarly in so many ways. In the case of malaria and in the case of most of the neglected tropical diseases, I would argue that there are tremendous return on investment in terms of America's role in the world and our global health budget. Right now, there are crucial discussions going on about foreign assistance, on how foreign assistance can operate more effectively, more efficiently. Well, I would argue to you that neglected tropical diseases and malaria, controlling those 2 sets of diseases, really represents some of the strongest return on dollars for foreign investment, for foreign assistance. Through the scale-up of proven, effective, and low-cost control interventions for both malaria and NTDs, the global community has been able to slash disease burden and deaths in Africa over the last few years. In so many ways, The work that we do in malaria, its great strength from a domestic policymaker perspective is the fact that our approaches, our investments are verifiable, they're measurable. It's very easy to see what the results are. We know precisely what to do. The only question is whether we as a society and we as policymakers are ready to invest the resources needed to get the job done. Well, in so many ways that's similar to neglected tropical diseases. I think that we are finally beginning to realize that attacking neglected tropical diseases really is a very cost-effective approach to foreign assistance. Interestingly enough, and some of us were talking about it before we got started, last night Bill and Melinda Gates were here in Washington talking about their Living Proof project. And they were talking about how foreign assistance is a great investment for the United States, in particular global health monies. And it was interesting to see that two of the strongest causes they talked about were going after malaria and neglected tropical diseases, and they were very much described in the same way: cost-effective, efficient, measurable, and verifiable. So for all of those reasons, it seems to me that this is the perfect time for those of us who care about malaria and neglected tropical diseases really to join forces as we go forward. With that, Karen.